Welcome to this video about establishing effective whole school approaches to prevent EBSA, part 2 of 3. Leading change. Mental health and wellbeing leads can lead change by developing and implementing the following: mental health audit, strategic review, mental health and wellbeing in school improvement plans, mental health or wellbeing policy co-produced and connected with other policies, for example, medical, health needs, bullying, behaviour, etc. A governor designated with responsibility for mental health. Working together. Mental health and wellbeing leads can mobilise people in the school to work together by developing and implementing the following: mental health action group, mental health section on the school website with advice for parents and carers, parent-carer partnership strategy or framework, parent-carer workshops focused on mental health, directories maintained for external pupil and parent-carer support, parent-carer drop-ins, and pupil wellbeing champions. Promoting wellbeing. Mental health and wellbeing leads can promote wellbeing by developing and implementing the following: safe space quiet zones, wellbeing rooms, etc. A calendar of mental health events, for example, assemblies, shared resources, activities, etc., especially during mental health weeks. Peer support programs, including befriending, buddy systems, etc. Mental health taught in the curriculum, including RSHE. Whole school pupil wellbeing and participation systems, for example, celebrations, school council, house systems, outdoor programs, etc. Reading materials for pupils on the subject of mental health, and displays across the school promoting wellbeing. Supporting staff. Mental health and wellbeing leads can support staff wellbeing by developing and implementing the following: staff training on mental health, signposting mental health resources, guidance, etc. in staff bulletins, intranet pages, and briefings. Supervision for staff working closely with pupils with SEMH difficulties. Staff mental health and wellbeing policy. Staff wellbeing survey. Staff drop-ins to talk with trusted staff members about their wellbeing. Staff wellbeing activities, events, routine supports, etc. For example, staff socials, sports, arts, relaxation sessions, away days, awards, etc. And counselling and other direct services for staff experiencing emotional or mental health difficulties. For example, EAP, education support, school counsellor, and referrals to occupational health. Understanding need. Mental health and wellbeing leads can work with SENCOs and other colleagues to ensure that there are strong systems for understanding pupil needs by developing and implementing the following: staff provided with differentiation and reasonable adjustments guidance for individual pupils with SEMH difficulties. Preventative wellbeing programs and interventions, including extracurricular provision, pupil self-care resources, etc. Pastoral support and safeguarding systems across the whole school. For example, risk assessments, pastoral support plans, behaviour support plans, individual healthcare plans, etc. Pupil wellbeing surveys. Using mental health screening tools, checklists, etc. to explore the possibility of SEMH difficulties. Referrals to assessing agencies and any triage or case consultancy meetings if available. And mental health in-school interventions, one-to-one and small group, delivered by qualified and trained professionals as provision for pupils with SEMH. Academic resilience. Resilience is often described as supporting young people's ability to bounce back. There is a consensus in the evidence base that promoting resilience means supporting the development of good personal life skills, helping children and young people sustain good relationships, and providing resources and interventions to ameliorate or prevent the potential effects of setbacks. The term academic resilience refers to how pupils can achieve good educational outcomes despite adversity. For schools, promoting it involves strategic planning and detailed practice involving the whole school community to help vulnerable young people do better than their circumstances might have predicted. Academic resilience is a protective factor against EBSA. Academic resilience factors. Basics. Basics such as food, housing, safety, play and leisure, and exercise all influence a pupil's ability to be academically resilient. Belonging. This is the extent to which a child or young person feels a part of the school community and a sense of belonging. Relationships are at the centre of that sense of belonging in school. For pupils who avoid school, learning to trust even one key adult in school can make a big difference. Learning. It is important to foster a love of learning, both within the context of the school's curriculum and more widely. Fostering academic resilience involves ensuring the development of interests and talents, noticing achievement, small steps of progress, and supporting them to develop new skills. Coping. This requires a focus on building skills to cope in life, like problem solving, flexibility, developing emotional regulation skills, and reaching out for help when they need it. Core self. Building a strong and positive sense of self is a critical element of lifelong resilience. Supporting pupils to learn more about who they are allows them to take responsibility for themselves, overcome problems, and seek help when required. Shared core values. A good place to start is to accept that your school, like all schools, will encounter anxiety and EBSA, and all people, even in adverse situations, have the capacity for change. Research indicates that recovery from adversity is facilitated by positive relationships, a sense of connectedness, and development of trust. The affirmation, appreciation, and development of strengths. A sense of safety, both physical and emotional. Recognition and empathic regard for what people are managing. Self-efficacy, people actively involved in their own change process. And offering hope. We will now briefly discuss 3 integrated guiding principles for supporting pupils with EBSA risk: early intervention, joint working, and flexibility. Early intervention. It is crucial to rigorously monitor attendance data and other forms of information which can indicate potential concerns at the earliest possible stage. Reach out to pupils and their parents and carers to offer support. And identify factors and address concerns as soon as possible. Support should be part of a graduated approach, underpinned by sound staff awareness of risk factors associated with EBSA, a sincere commitment to establishing a full picture, including professional curiosity, and genuine supportive conversations with pupils, their parents and carers, and staff. Joint working. Joint working involves working with and integrating the views of key people, including the pupils who are at risk of EBSA, their parents and carers, and staff who know these pupils well. Planning and reviews with these key people should be regular, for as long as EBSA remains a concern or significant risk. This is supported by clarity around staff roles, including first points of contact for pupils and their parents and carers, realistic response times, and specific actions that are routinely reviewed. Flexibility. EBSA is a very complex, multi-layered, and somewhat unpredictable phenomena, prone to unexpected changes. A rigid one-size-fits-all approach will therefore not be effective in this area. Flexibility within school systems means acknowledging the context of unique personal, family, and social factors, including both risk factors and protective factors, strengths in individual cases. Adapting approaches as appropriate. making changes to set plans when necessary, for example following setbacks or rapid progress, and thinking critically about any school systems changes which may be beneficial for effectively coordinating EBSA support in the future. This is the end of this video. Part 3 on this topic is now available to watch. You can view more videos on this channel in the EBSA Essentials series.